Well done, everybody. I'm going to say give yourself a round of applause. You're amazing. Yes. And of course, give a round of applause to your hosts and the people who made this possible. It is the combination of the Gupta family. Thank you, Rebecca and Sanjay, for being here. It is the Institute for Healthcare Policy and Innovation, the IHPI, and the Medical School Office of Development. They've made it all possible, and it is such a thrill to be here. Applause for those too. All right, folks. This is the time you've been waiting for. Perhaps you've been fearing. It is showtime. I have just in the corridors and from talking to some of you heard the exciting projects you're doing. I've heard how excited you are about them. Overhearing people on phones telling loved ones, man, you got to see this thing we are doing. It's amazing. That's exactly the vibe of a good hackathon. And yes, you've been doing amazing things, and we're all excited to see them presented. Now, you know the drill about clapping people off. You know you have 2 minutes. I know that's tight. For work that you've done over 24 hours, squeeze that down to 2 minutes. When you're tired, hard, really hard. The good news is everybody else has the same rules too. And so it's not easier or harder for you. 2 minutes, and we clap you off. The judges have the opportunity, if they choose to, ask questions. For that, we have allotted 2 minutes as well. They don't have to ask questions. Maybe your presentation is simply brilliant. You answered everything they ever wanted to know. Now that's fabulous. No problem with that. So it is up to them. However, their question and answer time is also timed to 2 minutes. And we will clap that off as well. And so I ask forgiveness ahead of time to the judges if I cut you off. I ask forgiveness of all of you if I cut you off during your presentation or during your answers. I know you worked hard. And the proof of your hard working is somewhere on a Google Drive. And we've looked at those a little bit, not very much, I'll admit that, but it's out there so that, first of all, you had the time to have lunch. That's important. But secondly, so that we know you stopped working at noon. It's only fair to everybody. So it's going to be a total of 4 minutes for everyone, but practically you may not get the second 2 minutes because this is a full house, lots of presentations. 2 minutes presentation, clapped off. Now we have people who are helping us keep time, and they will hold up. We've got Emma over there. She will hold up a sign. So if you're here on stage and you're speaking, there we go. Here's Emma. She's holding up a 1 minute sign. So if you're here and you're looking into the audience, this is where you will be looking. She will be holding up a 1 minute, a 30-second, and a 10-second. And after that, when that 10-second comes down, I clap. I also have helpers in the audience who help clap. And I want you to clap too. Clap for yourself, clap for others. And listen to the presentations because we do have an audience prize. And so at the end, I want to know from you in the room what you thought the best presentation was. And so don't just wait for yours nervously and don't listen to anybody else's. Be in the room, listen, pay the respect to the other teams who deserve it. Everybody deserves that respect. So with that, we've got the 2 minute presentation, excuse me. After your presentations, and that's going to take a while, there's 30 of you teams. After that, the judges will be led out by Elise and will deliberate. We here in the room will take a 10-minute break. You will probably urgently need to use the restroom. You may need a glass of water or a snack. 10 minutes and come back. Because the Guptas have graciously agreed to do a Q&A session. Now, I can't force you to come back, but I think it's going to be fun. And so you should be back in here, but without your snacks. So still no food and drink, you got it. We will also at that time ask for your vote for the best presentation, and we'll have a survey to hear what you thought of this event. But even after the survey, we would love to stay in touch with you, heard where you went. Whether you win or not in a hackathon is not the determining factor of the quality of your work. There are studies about hackathons that show that if one of you starts a company 2, 3, 4, 5 years down the road, and you're looking for co-founders, co-starters, you might call these people up. Look at your team members and think what you just went through. So yes, winning matters, but being here matters as much, if not more. So we will award, prizes and conclude. That's what it's going to be. And I am ready for your presentations. I have numbers and names of teams down here. I would like to introduce Dr. John Ainian, who will introduce the judges. That's wonderful. I would love to welcome Dr. Ainian to the stage to introduce our judges.
So welcome back, everyone. We started this great weekend on Friday evening over at the Big House, and over the course of yesterday and last night and this morning, we've seen how hard you have all worked. I want to congratulate you on your ideas, the effort that you've put into this weekend, and hopefully you've had fun, like many of us have had seeing you do your work over the course of the weekend. Before I introduce our three very esteemed and honorable judges, I wanted to specifically thank Sanjay and Rebecca Gupta for their support of this weekend, for their presence and really engagement throughout the weekend, the remarks that you shared with us on Friday evening and Saturday morning, and really being here through much of the day yesterday and back again today to really lend your support to the energy and enthusiasm that everybody brought to the Gupta Family Hackathon. So thank you very much. As a small token of our appreciation here at the University of Michigan, as you know, as both of you as alums of the university, we're very big into swag and sporting the Block M. So for each of you, we have a few small tokens of our appreciation: an HPI water bottle. It's been a very sunny weekend here, so we have University of Michigan HPI sunglasses. And my favorite, our very styling maize and blue Argyle University of Michigan socks. And I can vouch that they're both comfortable and warm, so as well as stylish. So thank you very much for your support. Let me just share these both with you. So now back to the work of the hackathon. So it's my honor to introduce our three judges, very accomplished in different ways. Our first judge is Dr. Preeti Milani. She's a graduate of the University of Michigan and now professor of internal medicine and infectious disease specialist at Michigan Medicine and the University of Michigan Medical School. She's also the chief health officer for the university and the director of our national poll on healthy aging. So please join me in welcoming Dr. Milani. Our second judge is a very innovative fellow. He's Dr. Kevin Ward, professor of emergency medicine. He is the director of the Michigan Center for Integrative Research on Critical Care and also the director of the medical school's Fast Forward Innovation Program. So he's thinking about innovation all the time. I know Kevin was very engaged yesterday making the rounds of many of the teams, hearing about your work in the early stages, and we welcome Kevin as second of our three judges. And then we're honored to have Robert Yoon, Mr. Robert Yoon, as our third judge. Robert is CNN's Director of Political Research. He's an Emmy Award-winning and Peabody Award-winning journalist. He's covered a range of important political stories for CNN, and he's himself, like Preeti, a graduate of the University of Michigan, and we're actually lucky to have him here this year as a Knight Wallace Fellow in the journalism program here at the university, and he'll be staying on next year as visiting professor of journalism in the Department of Communication Studies. So thank you, Robert. So rest assured that we have a very knowledgeable and fair and impartial panel of judges, and they'll be listening intently to all of your presentations. So I'll turn it back to Diane. Thank you.
Thank you. Excellent. All right. So now we have our judges, we have our teams. Are we ready? Yeah. Thank you. All right. So I would like to invite team number 1, Hummingbird, to the stage. And I would like team number 2, Medical Suitcase, to line up over here by the emergency exit door. And we're going to continue doing that. That is, when I call up Medical Suitcase, who will be waiting here, I want then team number 3, Healthcare Gamified, to come up. So basically we always have one team waiting here on the right-hand side, and we have one team up front pitching. And I'm going to just walk you through this while team number 1 comes up on stage and plugs in their laptop. While the team is answering the first minutes of questions, we leave their presentation up. The second minute of questions and Emma's timing, the next team, and that is team number 2 in this case, has permission to come up, unplug this laptop and hold it for them because they're still talking. They can't think about their laptop at that moment. Hold their laptop while you plug your laptop in. Does that make sense? And does that make sense to the rest of the room? Basically, in the second minute of Q&A, you unplug the previous team's laptop and you plug your own in so that we have a smooth transition. If I miss out on calling a team up here, or if at any moment there's not a team standing there ready to go, I encourage my team and everybody else to call me on it. We always want to have a team waiting so that we can have a smooth transition here. And without further ado, I want you to have a microphone so that you're not fighting around this one. Take one of those. However, you can stand here as well. I'll stand to the side. Team number 1, Hummingbird, and we're starting your time in a second.
Quiet. Patients and providers alike are inundated with the immense amount of health information coming from electronic health records, wearable devices, patient portals, and the internet. This cacophony results in the miscommunication that is responsible for patient misunderstanding and physician fatigue. Hummingbird is a platform that leverages patient data gathered by wearable devices and sends it to the appropriate provider at the appropriate time. It uses evidence-based guidelines and machine learning to distill the messages sent between patient and provider, reducing hospitalizations and starting meaningful, often life-changing conversations. As an application, we developed a prototype for heart failure. As the #1 cause for hospital readmission, with 2/3 of the related costs being due to avoidable reasons, we know that leveraging technology to prevent heart failure exacerbations can improve mortality and reduce costs. In this example, weight metrics and heart rate from Fitbit devices are used with clinically relevant parameters to help patients and their providers prevent these heart failure exacerbations. More details and a demo can be found on our website, hummingbird.science.
How is Hummingbird unique amongst its competitors? First, it's personalized. Providers can modify alert thresholds for each patient, bringing precision medicine to the masses. Second, it's intelligent. By using asynchronous communication and smart filters, we reduce the burden on patients to sort through the noise and on patients to decipher symptoms. Patients don't have to determine when to reach out for help. Hummingbird anticipates and precedes a crisis. Finally, our platform is adaptable. It's widely applicable to multiple disease states and healthcare systems. By distilling the information, Thank you very much.
Questions? No questions? That's excellent. Well done, team. So we're changing over to team number 2. I would like team number 3 to come down. Team number 3 is Healthcare Gamified, and we're about to listen to team number 2, Medical Suitcase. I'd like team number 3 over here. Wonderful. Thank you. All right.
Many people travel internationally. What if you get sick while you're in another country, or you lose your medicine, or your stay gets extended and you run out of medication? Can we make it easier on both the traveler and the doctor that you visit overseas? Our solution is to have My Medical Suitcase. It's an app or a website where you ahead of time upload your medical records, emergency contacts, medication list, other information based on the diseases that you have or the countries that you're traveling to or from. Other additional information is also uploaded into this virtual suitcase. If you go to a doctor's office in another country, you can just give the doctor the URL and a passkey or show them your phone and they can access your medical records. You could upload information to the medical suitcase. Caregivers can, your doctor can upload records. There's also that automatically generated content that I talked about, and this can be read by the doctor in the other country. You might want to include in this suitcase, and it's up to you how much you include and how much you don't. It's all your choice. Emergency contact information, your list of medications, vaccinations, and so forth. We're also going to automatically generate some pages. If you have a particular disease, we'll just upload a page on that disease, possibly translated. If you take certain medications, we'll have a page that has the generic equivalents or the dosage equivalents uploaded already. We might have a page, if you're traveling to a particular country, that lists the clinics and the emergency rooms in that country. Our solution is an app or a website, so it doesn't really require much other than some IT infrastructure, other than the online storage site. And we intend to partner with travel agencies or travel clinics or to promote the app. It's patient-driven, so you can upload as much or as little information as you want, and it's password protected so that that information could be shared. There's some options out there now, but they're not really for international use. Any questions?
That was rapid fire, judges. Do you have any questions for them?
What are the security measures beside, in addition to the password protection? What are the measures that you have to protect against the bad kind of hacking?
Part of the idea here is you might not want to put the most private of information up. This would be for stuff that you don't mind sharing if you take regular medication and you don't want people to know. But there would be the password protection, as well as there could be a time limit. So you could say, I'm going to share for only a certain amount of time when you know you're going to only be out of the country for a certain amount of time. The other is we're going to log. So anytime anyone accesses your website, we're going to log who accessed it, just to have some additional tracking and security in there, as security.
Any other questions from the judges? Excellent. Thank you very much, team number 2. We get rapid fire exchanges. That's wonderful. Much appreciated, teams. I would like team number 4 to come up here to stand by. It's Team Health Trust. Team number 5 is Bioline. Just, keep that in mind. You're next up here.
All right, so we worked on gamifying healthcare this weekend.
So the problem that we were aiming to fix is that young people with chronic illnesses have extremely low adherence rates.
How we aim to fix this problem is by creating a multiplayer, world-based gaming app. A lot of you guys already know games like this: Farmville, Yoville, Club Penguin. So kids are already playing these games, but these games are not making them active. We propose a game where they can log on and they can document when they take their meds, when they exercise, when they diet with their chronic diseases, or if they're just trying to have weight loss. Every time they do these actions, they'll receive coins and health benefits, and every time they don't, they'll receive negative consequences such as leveling down or losing coins. With these coins, they can purchase furniture, clothes, build their avatar up, build their virtual world up. Also, within this game, we would have a chat-based system so that they could talk to verified healthcare members if they wanted to, and also they could create a community of other kids that have these chronic illnesses, because oftentimes the reason that they are not adhering to their medication is because they're the only one with diabetes, or they're the only one with ALS or HIV in their class, and they feel isolated. So this is an example of a virtual world that they could enter. There would be the clinic where they could receive information on chronic diseases, the marketplace where they could use their coins and buy things, and the chat cafe where they could talk to other kids that have their diseases, as well as healthcare professionals if they have immediate questions. They would receive weekly emails. We figured if we're collecting this data in the app, we could use this data also. So they can receive emails, or their parents, if they're a younger kid population, can receive these emails documenting their stats. What are they weak in? Are they good at meds but bad at exercise? And then the physician can also have a document, because a lot of times these kids are lying on their documenting charts that, oh, my glucose was fine. By inputting it, we can keep track.
So 8 million kids play Farmville every day. So incorporating their healthcare into games like Bioline.
Stick around. We want to see if the judges have questions. I'm going to go to the other side. Judges, do you have any questions for them?
I'll just speak a little more about how will you hold them accountable for the truth telling.
So we talked about this. If they're a younger population, there are pill bottles that once you remove a pill, there's a documenting method. Also, the other thing is there are games like this for education, like watching a lecture gives you points. And the whole point is that if you download this app, most likely if it's an 18-year-old, they're downloading it because they want to make a change. They just don't have a way of being held accountable. And so they most likely won't lie, because then they will just play a different game.
Other questions from the judges? All right, thank you very much. Next team up presenting is team number 4, Team Health Trust, and I want team number 5, Bioline, to come up here and stand by the door. Do I have a team 5, number 5, Bioline? Yeah, all right, good. And the next team that will be up after number 5, Bioline, who are coming down now, will be team number 6, Just Say Hey. So just you know, keep track of each other. Excellent.
Hello. We'd like you to meet Sandra. Sandra's sister needs a kidney. Sandra talked to her doctor about being a potential donor. However, she went home after her appointment and realized she still had some more questions. And so she did what most Americans do and went online to look up some more information. This is what she found. She found a sensationalist article, decontextualized Facebook information, and a really dense article that she can't understand. None of these things actually help her figure out what information she needs or wants. That's where Health Trust comes in.
We want to empower Sandra to get the information she needs, to bridge the gap between the misleading and the dense. She can access that information on her phone and receive notifications on current medical treatments, medications, surgeries, anything that's really of interest to her. It'll act like a clearinghouse, kind of like Travelocity for health information, less work for the consumer. There's a lot of existing sites that do provide this information, but most of them are really text heavy, and we already have a huge degree of information overload. Plus, we're wired to process and understand and remember pictures so much better than text. This is really a feasible project because we plan to collaborate with the great numbers of U of M experts who already work in fields that will build this product. And we're going to partner with the growing number of journals and researchers who already produce beautiful visual abstracts.
For dissemination, a key portion of our project is to partner with doctors and healthcare providers to provide flyers to their patients so that when they come home, they can know that there is a source out there for medical information that their own doctor will trust.
All right, Team Health Trust, thank you. Judges, any questions?
Hi, just wanted to get some clarification on who's making the abstracts, and is it visual abstracts that you would provide?
Yes, so the visual abstracts would be made by a combination of the journals that produce the papers themselves and medical writers that are specifically assigned these tasks.
Other questions from the judges? That looks like a no. Thank you very much, Team Health Trust. I'd like team number 5, Bioline, to come up. And team number 6, Just Say Hey, to come down and stand by the door, please. And I think just making sure that you're close enough to the microphone helps. All right. Team Just Say Hey is coming down. Excellent. And team number 7, the next one up after Team Just Say Hey will be Healthcare 101. But this year is Team Bioline.
When it comes to blood, every pint is precious. Last year, the American Red Cross declared one of the worst blood shortages in the organization's history. And every year, up to 340,000 pints of expired blood are discarded by the US every year. With 1 pint able to save up to 3 lives, at this rate, we're basically throwing away over 1 million lives. That's greater than the population of Detroit. And this is why we created Bioline. Bioline is a digital platform that is able to facilitate communication, data analysis, and logistics between blood product stakeholders. After making a profile, institutions using our platform, such as hospitals, blood banks, can view their blood use rate and how soon their blood supply is about to expire. This information is gathered through daily reports that are submitted through the inventory feature. On this feature, institutions can record new blood supplies with expiration dates, in addition to reporting what they used that day. Furthermore, stakeholders in need have the opportunity to request blood from nearby institutions that may have supplies about to expire. On this form, they'd indicate how many units of blood, each blood type, they need. Additionally, if other institutions are in urgent need of blood, nearby stakeholders will receive an alert that asks them to donate depending on their current blood supply and blood use rate. Here, they're also able to see what local partners are donating to that institution and how much is still required to meet their need. Another feature we want to highlight is that based on institution blood use rate, the platform can detect if excess blood is about to expire and notify the institution. This feature gives them the opportunity to donate that blood supply before it goes to waste. And for demo purposes, we're only highlighting these features, but we also have other notifications. In conclusion, when it comes to blood, we can't afford to throw away what could save the population of Detroit. If you too want to save the world 1 pint at a time, we ask for your support and now open the floor to any questions. Thank you.
Very good. Do we have a judge question? All right.
How are blood donations handled now by the American Red Cross or other organizations that are working in this field?
So currently, there are emergency systems in place to help allocate blood in crisis situations. However, those methods are very fragmented, and there really is no concrete system in place to allow for institutions that have blood in excess to then allow other institutions in the area to claim blood and really streamline that communication and redistribution.
Any other questions?
All right, super, thank you. Team 6, just say hey. And I would like Team 7, Healthcare 101, to come down. And I appreciate you all helping out with the clapping, given that I'm holding a microphone. It's so much more helpful that if you hear the clapping, you help with the clapping. Thank you. It's also nice to your colleagues.
Okay, so according to recent census information, there are 11 million Americans 65 and older who live by themselves. And numerous studies spanning like multiple leading research institutions have shown these feelings of loneliness to be strongly correlated with things like dementia, depression, worsening cardiovascular health. And so our idea is basically to take the underlying fundamental principles of social networks and to extrapolate that and to create a real world social network that then facilitates real world interactions between members of this otherwise vulnerable community.
So our ultimate goal is to create a platform where facilitators can connect lonely elderly individuals that are similar to one another. So there's 3 stages to this. The first stage is we approach people like funeral home directors, primary physicians, people that firsthand see these like elderly, vulnerable people. They approach their caretakers, and the caretakers can have a conversation with these friends or relatives and ask them, hey, would you be interested in joining this program? And if so, what they can do is we can work with them to gather relevant information. What are your interests? How do you like to communicate? Would you like to communicate with someone over the phone, via email, via snail mail even? And then we have our facilitators organize, connect them. So for example, through the phone, they'd call us, and we'd connect them to another person on the line, or they'd send mail to us, and then we'd forward that on to the next person just for security purposes.
In essence, we're proposing a simple, scalable solution to a really, really big problem. And the idea is that if we can do something simple, just give people in this demographic something to look forward to, something to maintain a positive disposition, something to keep them connected and to keep them engaged, we think that is something that'll touch each and every one of us, and the implications are going to be tremendous, truly tremendous.
Each and every one of you have a parent, a relative, an old person that may be lonely, that may be needing social interaction, and this is how we want to
Thank you.
All right, excellent. Just say hey. Do we have questions?
Yes. So one sort of two-part question. One is just the technology issues and whether those might be a barrier for this particular population. And the second piece is that scams are a big deal, and it's an issue that might prevent trust. Have you thought about that?
Yeah, so to the first part of your question, that's kind of the essence of what this platform is all about, is that these technology systems are so easy for us, but we wanted to use forms of communication that people in this demographic are already familiar with. So email possibly, writing letters, using phone calls, and then using those channels to then connect them to each other. And with regards to scamming, the whole idea would be going through a centralized kind of hub like us, so you wouldn't have to give out your personal address, your personal phone number. We would be on the end saying, for instance, hey, Jan, we have Susie here. You both have grandchildren, expressed interest in knitting, something like that, just to get the conversation going. It sounds like a very simple concept, but we want to really emphasize the power of something like this and how it can really have long-standing effects that span physical and mental health. And so, yeah. Thank you.
All right, thank you. That was Just Say Hey. And I want to encourage team number 7, Healthcare 101, to come up. Also, make sure you stand in the spotlight and you're close to the microphone. I think and you've got 2 of those in case you're switching off. That looks like a great picture too. And I would like to have Project 8, Project Check, come down here and stand by the door. Stand by. Project number 8, Project Check. And CHECK stands for Communicating Health Education Through Community Kinship. Coming down, very good. And number 9, who will be coming up after number 8, is We Found. So be prepared to come down next time. All right. So we've got Healthcare 101.
So everyone has a fear of the unknown, and the same applies to the US healthcare system. We're all scared to navigate a system that we don't know much about. And the information that we find online is often fragmented, scattered, hidden in dense articles, or opinionated and subjective. So what Healthcare 101 did is we built a website as a resource to educate ourselves about the healthcare systems and the behind-the-scenes way in a digestible manner.
All right, so here's our website. And what makes our website special is how we have information specific to certain situations that you might find yourself in. For example, you're about to get booted off your parents' health insurance. You've been recently diagnosed with a chronic illness. You're new to the country, or you're just curious. So the page for each scenario will guide you through understanding what to expect in your situation. For example, how your insurance might change based on your new diagnosis. We also have a high-level overview of the whole system, including examples for someone who might be starting from square one. And we also have a further breakdown of each section into its components. So we have providers, we have a section on payers, and we have a section on vendors. And here's an example of what the page on the pharmaceutical industry might look like. You'll see that we have a more comprehensive breakdown of the pharmaceutical industry that will include colorful infographics that really make it easy to understand. So future directions with this website would include building in a section that looks at the current state of the system and changes that could occur in the future, whether that be through technology or policy changes. We'd want to approach teachers, community centers, and health providers and encourage them to direct their students and patients towards this resource.
The impact that we hope to have is to encourage more people to understand health policy, decrease the amount of mistrust in the system, and encourage people to make more educated votes.
All right. This was Healthcare 101. Questions from the judges?
What's your plan for getting this disseminated for people to use it?
Yeah, so one thing we want to do is reach out to community centers and teachers, as we mentioned, and also providers, and kind of give them a survey, give them our platform to get some feedback from them, because chances are that they have some frequently asked questions they come across that could help us. Also see what they think about it right now, and kind of see what feedback they can give us to kind of make our website better. So go out and get a survey of different areas. Any
The
others?
questions? All right. Thank you very much. We have Project Check coming up, and I would like number 9, We Found, to come down here. After them, number 10 will be Team Care Connections. Be mentally prepared. But we've got team number 8, Project Check, coming up. And make sure you have your entire team a little bit in the limelight. You're hiding. And I understand that you're hiding, but you know, you're a great team. Come on out.
Good afternoon. We are Project Check. Project Check is communicating health education through community kinship. The 2017 Gallup Community Wellbeing Index, which captures overall outlook on health, ranks the Detroit community 145 out of 186. In addition, Detroit has one of the highest 30-day readmission rates for chronic diseases, resulting in high CMS readmission penalties for our hospitals. Throughout the country, community programs have shown success in improving well-being and decreasing readmission rates. The problem is, in Detroit, wellness resources are not accessible to all, resulting in non-engaged population. There are many programs, but a variety of reasons, their outreach is limited. An ideal state would be that all individuals within the community are motivated and engaged to improve their individual health. Our proposed solution is to utilize trusted neighborhood relationships to facilitate motivation and engagement, a community kinship. Our dissemination plan is 1, first meet with the Detroit Department of Health to identify areas in Detroit with the greatest health challenges and the community health centers in those areas. Second, meet with the community health center and ask them what areas they're unable to reach. Have them identify current participants who are highly motivated to serve as community advocates. Provide training to these advocates on motivation skills and importance of reaching and helping kinship in their community. This is an new innovation that is in other areas has shown success. Having trusted community advocates reach vulnerable individuals who are currently not utilizing resources, engaging them, and connecting them to resources can increase outreach. Our proposal flourishes community kinship to increase outreach. Check. Check on neighbors, check on your family, Project Check.
Sorry about that. Any questions from the judges?
Is there plans for interactive tools built in for outreach from potential customers to the advocates?
Yeah, the thought is once we identify what the health issue is, and it could be different depending on the community, look to see what different resources out there, and so that when we're educating these patient advocate or these community advocates, we're not expecting them to teach the other people, but to connect them, but to be able to motivate them and then give them additional resources of where to go. So absolutely, we need to identify those specifics depending on the issue.
Any other questions from the judges? That's a no. Thank you very much. That was team number 8, Project Check. And we would like team number 9, We Found, to come up, and team number 10, Team Care Connections, to come down here. And for you as well, don't stand in the dark. You can shuffle in a little bit more into the light.
Everybody, We Found. We connect the clinic to the research. Dr. Sujai is reading a paper over here during lunch, which states,
the role of bursting neurons is a primary contributor to epilepsy.
On the other side of campus, we have a physiologist and a biochemist who are researching seemingly disparate topics.
Brain cells exhibit a high degree of bursting due to overexpression of T-type calcium channels.
T-type calcium channel activity is reduced when exposed to TTA compounds.
Now, these three observations are seemingly unrelated, but in fact, they are. And that could lead to an important therapy. These papers contain key findings and phrasings that are connected semantically. These connections might suggest that Dr. Suitcase should be looking at TTA compounds to treat epilepsy. Unfortunately, he isn't part of the Biochemical Society, and he will never know about this potential treatment for epilepsy. These kind of knowledge gaps exist all over the research community. That is the problem that we solve. We create a knowledge graph of interests and findings from entire phrases, not just keywords. We are a movement. But how? I'm glad you asked. We are creating the best tool to manage this.
When you highlight something in our platform, it becomes part of our graph. The best part, it's free to you.
We've also already created documentation for our API, which you can find on GitHub. Our API essentially creates a link between our database and the outside world. Our first step would be to to provide free access to clinicians, researchers, and students to use our database and provide us with data, which we can then use to open up our API and sell to third-party publishers.
Our competitors have key gaps in what they offer. Many do not offer knowledge gaps or organize scientific findings, and most importantly, the platform can get very expensive for users. We also have additional slides for financial assumptions and a 5-year projection.
Thank you.
Thank you, and sorry for cutting you off. Judges, questions?
Will you have the actual peer-reviewed research on this website? And if so, how will you get around copyright issues?
No, so we actually take in
microphone.
Oh, sorry. So we're actually using what people are highlighting, and so we can take, it's actually like a user input instead of something that we're actually grabbing from the raw data. So essentially that's their content, and they'll always own that, and it'll be anonymized.
Thank you.
Other questions? I have to say, kudos to the team for enthusiasm in the face of a complex topic. Let's get the next team up. Thank you. This was team number 9, We Found. Team number 10, Team Care Connections, is coming up, and I would like team number 11, Elmo's World, to come down here. All right, team number 10, Team Care Connections.
I think I'm gonna MA skip.
Also, thanks everybody. This is going pretty smoothly. Like it.
Okay. Infant mortality is significantly higher in Detroit than the rest of Michigan, specifically among low-income pregnant teenagers, because they're often stigmatized and do not have access to proper support and health care that they deserve. Existing services are often focused on pregnancy prevention rather than actual care and support once they are pregnant. We want to create a mobile application called Care Connections to connect young women to the proper health care and support that they need to make informed decisions about their pregnancy. We also want to assist them in getting to and from regular appointments to help lower their risk for low birth weight babies and infant death. This would be just a sample of what our app would look like. And to get this word out, we were thinking about putting flyers in places that youths frequent often, such as schools, grocery stores, youth center, and corner stores, to reach that population that may not have gone to a doctor yet and actually still need to go get care. And then our first part of the app would be connecting you to a health center. So we'll use your insurance, whether you have it or not, to show you places that either take your insurance, or if you're uninsured, that you can go to anyway. And then we'll also have a support chat. So this will be a group chat where you can talk to other young girls who have gotten pregnant themselves, so you know that you're not alone. And not only will it be in the app, but there will also be a texting option. So if you don't have data or Wi-Fi available to you, you are still able to use that. And then we also want to partner with Lyft and Make Your Date, that initiative to give free rides to women to and from their health appointments to get them to actually go to their appointments regularly to have a healthy pregnancy. That's it.
Well done for finishing early, team. Questions?
Yes. So what's your plan in terms of curating all this information, a lot of which is going to be changing regularly? How do you plan to stay on top of all those changes, and how would you, I guess, fund this enterprise to, devote the resources to stay on top and keep the app up to date?
Well, we were definitely thinking of sponsorships, especially like with places like Planned Parenthood. Obviously, Planned Parenthood wouldn't be the only health center, in the app, but what else would we
Also, just like also working with social workers to kind of mitigate, like take out the work from them so they could also like support us, and like other community health centers that can help support us through this app and to help more populations in this area.
Any other questions? All right. So we have Team Elmo's World coming up. This was Team Care Connections, Team Elmo's World coming up here. And I have team number 12, OCare. Come down here, please. No, you're part of that.
Hi there, we're Elmo's World and we're introducing Shamu. The doctor-patient relationship is currently confined to the 10 or 20 minutes spent on an appointment, and that's where the relationship ends. The patient heads home with their discharge instructions and loses or trashes them, forgets the details, and can't take action. Shamu is the communication and relationship bridge between doctor and patient. Shamu becomes a living plan that gets the right information to the right person at the right time. It is both actionable and interactive. The platform is composed of two key portions: Ample, the medical plan language, and the engagement engine. Ample is the open source language we created to transmit medical plans into readable, communicable, structured language. The engine turns this information into an interactive living plan. And for dissemination, we would work directly with clinics, hospitals, or health systems to customize modules for their unique specifications.
So here we have an example of a physician discharge note that's been translated into Ample by our Ample translator that uses machine learning and natural language processing. One of the nice things is that we can use the context from the EHR to look to see if there are things in the plan that may be missing, like what's going on with this guy's diabetes, doctor. And then there's also our engagement engine that has 3 different modes that we'll actually describe during our demo. So the first part of the demo is, let's say I came back from Dr. Paul's office, and instead of having that packet of information, I actually got a text with that plan. Second day, I noticed I was peeing a lot, so send a text. Why am I peeing so much? Well, our app looks at our Ample, looks at the EHR, looks at some background information, tells you you're on a diuretic. That's expected. You can also do various other interactions, but let's not get into that. What we want to do is take the plan out of the trash, put it at the center of the relationship between the physician and the patient, and make sure that they both have information just in time.
We're also done just in time. That is beautiful. Any questions from the judges?
So how would you handle health literacy and tailoring this to the reading level and the understanding level of different patients that may not interpret the information?
So that's a fantastic question, and we actually had a good discussion about that when we were sort of doing our design. And one of the things that we didn't get to touch on, but we wanted to have in Ample and in our system, actually a way of adjusting sort of how much we know about the patient's health literacy, so that the information that's sent back to the patient is customized to sort of what we know in terms of their maybe reading level, or even what their preferred learning style is. So it could be graphics or even language.
An IVR component could also be added if patients are illiterate or unable to do language in English, could be in a Spanish version, etc.
Any other questions? All right, thank you very much.
Thank you.
Team Elmo's World, number 11. And coming up now is Team OCare, number 12. I would like team number 13, the NICU Dashboard, come down. And after that will be team number 14, Nouveau. I also want you to stand in the light, not hide in the dark.
Hello, everyone. We are Team OCare. So we built a web application named OCare to collect family health information. We integrate the genetic, environmental, and social factors so that we could give better prognosis of different kinds of disease. Our application built bridge between the family members and between the users and doctors, also between different health facilities, so we can improve the information share and the communication. Our project could offer dynamic prognosis of family-based disease. We also establish an opt-in principle to protect users' privacy. This is how it works. So the users and their family members and also the healthcare facilities can all contribute the health information, and OCare will integrate all the information, apply computational and statistical technologies to provide individualized healthcare suggestions. Also, OCare will also contribute to family-based disease studies. Here we will show a prototype of OCare webpage.
So we developed this web application using Python and Flask development. And this is just an initial welcome web page for the current user, who is Lily at the top right corner right there. As you can see, she has basic information that we can see, that she can see, as well as her family tree, because we use different factors such as family, environmental, and social factors in order to compute her risk for different types of diseases, such as diabetes or any other disease she's interested in. As she puts in different medical information about herself, and her physician can as well about her, we can give her a report on her status in terms of those areas, as well as her risk for such disease, as well as suggestions.
All right, questions for OCare?
So can you speak just a little more about the access of genetic information and how you'll control security and things like that?
Oh, wait, sorry. So for the privacy protection principle, so we actually define different degrees of credential levels. So of course, the doctors will have the most access to the data, but still they need the consent from the affected patient or the users. And the patients, although they share the information with their family, but they still need but they only are able to access the suggested conclusions. That means they cannot access the raw data. They cannot access the score function or score information. That means like the result of your models, you cannot get it. You can just get suggested information. So yeah, and also the sharing, they need the consent with it. Yeah.
Other questions for Team OCare? All right, thank you very much, Team OCare, number 12. I want team number 13, the NICU Dashboard, to come up. And I would like team number 14, Nouveau, to come down here. And if you're, say, more than 2 or 3 people, just pay attention to the light. The lighting is a little weird, and you two are in the dark. Come a little closer. I will not bite, I promise. All right, thank you.
Good afternoon, everyone. We are Team NICU Dashboard. So this is my son, Dominic. He was born 4 weeks early and was in the neonatal ICU for 3 days. But we were really lucky because most babies are in the NICU for 1 to 3 months.
Parents of babies in the NICU are overwhelmed by the experience and the fire hose of daily information from clinicians. Our dashboard for parents of NICU babies translates this complex information into easily understood diagrams.
Many parent decisions for NICU babies revolve around growth and breathing, so we'd like to demonstrate how this interaction might work.
Hey, doctor, we're here for an update on Dominic.
Yeah, let's take a look at how he's doing.
What a relief. More leaves today means baby's growth is better than yesterday.
Oh, and I see that we still are at the same place on the rainbow, so we're still doing okay with breathing.
Thank you for the update, doctor.
You're welcome.
Actually, you know what? Could we go into a little more detail like we did the other day about his growth?
Yeah, sure. Let's just click through to see his growth chart. So we can see that over time, he's been doing really good with weight. And I think for today and tomorrow, let's focus on increasing his calorie intake.
Okay, great. Thanks, doctor.
You're welcome.
So in addition, we've not shown here, used a business model canvas to lay out our vision to take this from a prototype to a viable product that can be displayed on hospital TV rooms or on a tablet if necessary. And hopefully this will provide value to the patients, to the providers, and to the hospital itself. And this should be scalable to the point that it can be used for any sort of health information that needs to be clearly displayed in a way that even beyond the ICU.
Here's another big innovation. With this dashboard, loved ones can remotely check the status of their baby, and parents can continue using the dashboard with their baby as an outpatient.
Overwhelmed parents of babies in the NICU need an easy way to understand their baby's health. If I had had this product when Dominic was in the NICU, I would have felt more comfortable communicating with doctors about his status and progress.
All right, Team NICU Dashboard. Any questions for that team? You get to say no. I think that's a no. That was clear. Thank you very much, Team NICU Dashboard. I would like team number 14. Hey, and that doesn't mean it's good or bad, right? It means it was good. Go for it. Team number 14, Nouveau, we would like you up. And thanks for walking closer. You heard that I'm not biting. Excellent. Like it. And I would like team number 15, Spool, to come down there. Also, I have to say, thanks for bringing back that balloon. I remember you as a team where the balloon totally made sense. Or not.
Can I take the mic off?
Yes, you may.
Hi, everyone. We're Team Nouveau. Today we'll be presenting NatuRap. I just want to start off with a quick question. How many people here are vegan or know someone that's vegan? Share. All right. The irony is none of us up here are vegan. And I mean, of course, too, we have the hamburger, so that's taken into account. However, vegans account for 6% of the American population, and yet they're unable to get access to a lot of the information necessary for them to live a healthy lifestyle, as well as those who choose to try and sustain or switch over to this type of lifestyle. They lack the accessibility to a lot of the information necessary in order for them to maintain and continue to maintain the necessary nutrients, vitamins, and different proteins that they need to, and just further pursue and transition over.
Even if you're not vegan, I'm sure you have friends and family who are vegan, and when you're dining out, it can be very challenging. So what we did with our app is you type in your zip code of where you're at, and it's going to bring up restaurants that may be vegan, or restaurants in general that we tailored to say what will be vegan on the menu. From there, it will give you the limitations of what's lacking. And that's our main goal, is that we are trying to focus on how to meet your daily need. So with our bar right here, is the whole bar represents what you need to meet the daily goal for your health outcomes. With the filling in of the green is what you have already accomplished for the day, and then what is basically in the shaded area is suggestions. So we are aiming at giving you a diary of what you can do with, okay, Panera, we have choices. From there, you've only gotten halfway for the day. We're gonna go further and give you things to do to fill those gaps. So with vegans, vegetarians, plant-based, we are trying to aim for making those gaps filled.
And wouldn't it be great to integrate voice-guided assistance into our app for users? Hey,
As a healthy vegan option, this choice does not meet your daily allowance requirement. You may want to try adding a Scoochie apple salad choice.
All right. Any questions for this team? This is Team Nouveau.
What's your business model for funding the app?
Essentially, our plan is to initially first pair with a lot of the already existing apps that are working to take in calorie count, as well as a lot of other information. It was brought up that Share People is one of the many websites, programs that already exist.
So kind of piggybacking and partnering on with the already existing infrastructures and the ability to associate ourselves with those types of models that are already existing.
Any other questions for them? No? Well done, team Nouveau. That was 14. Coming up, number 15, Spool. And I would like team number 16, ShareCare 2.1, to get ready. So team number 16, I would like you down here, ShareCare 2.1. After that, you know the drill, ShareCare 2.2 and 2.3. So, but I don't see, I hope ShareCare 2.1 is coming down here, and we're ready for Spool.
All right, we present you with Spool, a real-time med-thread platform. EMRs are good documentation archives, but they were not built for communication. We propose a platform that facilitates real-time communication between providers and patients and among healthcare providers. This communication is then translated into documentation. The platform utilizes existing EMR and utilizes nothing more than a smartphone and TV. We'll walk through the use of the platform in the inpatient setting.
Let's consider Miss Mays Blue. She's in the hospital 4 days after her bypass surgery, and her team is scheduled round for 6 a.m. tomorrow morning. The app then alerts her to the fact that rounds is scheduled for 6 and prompts her to ask any questions for the team in the morning. The next day, after rounding on the patient, the team decides that she needs to have a white cell count ordered as well as a CT for the right lower extremity to make sure she doesn't have an infection. The app uses natural language processing to seamlessly create an order directly from this message, which then is just required to be verified and signed by the patient, by the provider. The provider then is able to seamlessly integrate the order into the EMR, which is available for documentation and billing purposes. So this is what the patient sees, and you can see that she has a CT scan ordered for tomorrow. After it has been scheduled for 2 p.m., it's automatically updated on her TV. This accumulated message traffic is then translated into the EMR for further documentation and billing purposes, preventing the provider from having to write a completely separate note. Dissemination for this product would be fairly simple and low cost. We could pilot the program at Michigan Medicine, and as we expanded, there are potential natural partners in both industry and the public sector.
The capabilities of this platform extend beyond just communication. It has the potential to address other significant challenges in delivering patient-centered care. Spool, a real-time med-thread platform facilitating communication.
Thank you. Any questions for this team?
Just want you to underscore how much input is required by the physician or clinical staff. Is it all natural language? And who verify? What's the verification mechanism to make sure that the messages are correct?
So the physician does it themselves. So after they enter in just sort of a short message like the one that you saw, extremity looks red, rule out infection, then the next prompt for them would be the order that's generated, and they had a variety of different options to click from, and as long as that was right, that would be verified and sent. And then for what appears on the patient screen, there's sort of a patient-friendly thing that says, we want to make sure you don't have an infection. You're getting a CT today.
And this will be verified at discharge when someone's signing their discharge summary to make sure everything that happened to them in the hospital was correct.
Any more questions from the judges? No? Thank you very much. Excellent. This was team number 15, Spool. And up is coming team number 16, ShareCare 2.1. And I would like team ShareCare 2.2 to come down and 2.3 to get ready. Also, you're in the dark. Come closer. It's tough love, but it's really love. I mean well.
Welcome to Taubman Hall. My name is Elmir Kirimovich, and I'm an experienced healthcare business professional. But more importantly, I'm a member of a collaborative multidisciplinary team of teams, here to share with you today the evolution and revolution of digital healthcare communication. ShareCare 2.x, all-in-one health for all. There's no better time than now. Our collaborative focuses on how to improve upon the current state healthcare application and evolve to being an even more creative, pragmatic, and impactful tool for healthcare communication, and a resource for awareness for healthcare tools. This is important because a common theme shared with us today for the past 2 days actually is the right information at the right time for the right person. So a quick reminder of the triple aim. With that said, the other day, Jeff Arnold shared with us how ShareCare can fulfill this aim and be an even more better foundation for how SharePoint can be an impactful tool. So with that said, using standard business methodologies, we've looked at the strengths, weaknesses, and risks for how we could improve ShareCare 2X. And with that said, we have 2 distinct opportunities that we've identified. Those are digital ADA compliance and also mental social health awareness. With that said, I'd like to invite my partners, David and Ajan, to continue the healthcare evolution.
All right. Sorry about that. That was off. Do we have one question from the judges, or do you want to hold questions until all 3 teams have gone? I leave that up to you, teams. Maybe hold all questions. All right. Let's have the next team come up, ShareCare 2.2. These are 3 teams that collaborated to some extent, and I think that is an example of the spirit of hackathons. It's not merely competitive, it is also collaborative. So we've seen these 3 teams work closely together. I want to make sure that ShareCare 2.3 comes down here so that we have you ready, because there will be no questions between the 2.
They're ready.
Excellent. 2.2, go for it.
Okay, as we just heard from Emil, ADA compliance is a huge issue. So what is the ADA? ADA is American Disabilities with Disabilities Act. So we know that that requires people to have certain capabilities to allow people with disabilities to be able to have access. So usually when we think of ADA, we think physical. We think ramps and parking. But why is it important? Because as we see more and more, there's more and more lawsuits being taken for websites that are not ADA compliant. So what does this mean for us?
So this is an example of digital architecture. So when you look at the vision on the left, that's the same site of CareShare in full vision, and then that's on the right. There's a person looking at it with color blindness, having a totally different experience. And oftentimes the designer or the development team or even research isn't considering these different experiences as we move into this kind of digital realm. So next you're going to see, this is a screen reader experience. So weird, right? So this was this experience that you were hearing. So if you were visually impaired and you were using Chrome's Vox screen reader, that's what this would be capturing. So this looks beautiful, but it's not super functional. So this is a prototype that we created. So maybe there's a soft barrier where you ask and you humanize the concept or the experience a little bit, and you say, what kind of experience do you need? Do you need a little bit of screen reader assistance? You know, and if you do, color doesn't matter, images don't matter, but the text is really important. So the way that the language on the site is communicated to the users. And we see this as being a real opportunity with ShareCare as being a benchmark and also leading this kind of effort if they are wanting to capture everyone's health data in one place. And you know, we don't want to leave anyone behind. So here you can help open the door, but in this digital world, how are you going to help open the door when somebody's trying to access a website or a digital environment? Thank you.
All right, we said we were going to hold questions until the 3rd part of your team or the 3rd ShareCare 2.3 had gone.
Hi, I'm Stephanie.
And I'm Juliana.
And we're here to you to present an idea to implement mental health education in schools utilizing the ShareCare platform. I don't know about you, but when I was growing up, I never received mental health training in school.
I want to ask you guys to think about your high school education. 1 in every 5 of your classmates suffered from a mental health condition but never received education on it. A majority of these teens did not graduate from school. So what do we do about it?
Introducing Psych EDU. After a review of the ShareCare app, we noticed a missing component of the team targeting the teen population as well as mental health. Psych EDU will serve as an educational platform to cover topics on different mental health conditions, symptoms, management techniques, medications, as well as the initial self-risk assessment and resources available to middle school adolescents.
For example, 2 out of 3 kids with depression will go undiagnosed. The CDC explains that at times many of these children do not talk about their helplessness or hopelessness. Psych EDU will provide the educational platform on depression, giving them an avenue to understand their condition and seeking treatment.
We propose the 11 to 13 year age demographic because many mental health conditions begin to manifest or worsen in teens ages 13 to 18. Acting early is critical to prevention and early intervention.
Currently, New York is the only state in the U.S. that will require education in the school systems beginning in the fall of 2018. However, the curriculum and how it will be implemented is still undecided.
We believe Psych EDU will serve as a platform and resource for students and educators to start the communication around mental illness. Today, more than ever, it is critical that we educate our teens on what mental health is.
Together, we can make a happy and healthier tomorrow for our teens and our nation.
Thank you.
All right, excellent. So at this point, we can have questions for all 3 teams. I know that you have collaborated as well as competed. That's going to be interesting for the judges. Any questions?
So I have a question for 2.3 regarding the Psych EDU. What role will parents play in this app? Will they have access to the information? If their child is in crisis, will they be informed in any way?
So right now we see this as primarily an educational tool to be implemented through the schools, so with teachers. So teaching them what different mental health conditions are, and as well we said giving them an initial risk assessment, but it's not to take place of treatment as of now.
We're not going to be diagnosing anybody through this app. This app is merely a tool for educators and school systems to use as a resource, as a thing that they're used to. Everyone's using an app nowadays to be comfortable with looking up, looking at what their symptoms may be and learning telltale signs of, deeper and more severe conditions.
Yeah, and if you think about it, health education or PE, those are mandated in most schools, but there's no requirement for mental health. That's such a big topic that we need to educate people on.
I think we think Psych EDU can help form that in our school systems.
I want to give judges the time to think of their next question while I call up team number 19, HeartNet, to come down because I neglected that earlier. Team number 19, HeartNet, come down here. Judges, do you have another question for either of the 3?
Yeah, for the ADA, how is, or is there going to be a way for, again, customers to sort of interact with the system to suggest best practices,
Yeah. So unfortunately right now is we're moving to this kind of template platform. So if we start to kind of build these systems and integrate them into already existing architecture, similar to you see in physical buildings, they're starting to already include ramps or consider the possibilities when they're doing the pre-planning stage. So we see this as an opportunity to start to educate and inform that this world isn't just an app, it's not just that, but it is a physical or a digital space that people will be accessing and getting a lot of their information or spending much of their world in the future. So we see this as a kind of a speculative design approach to something or a problem or a crisis that might be 10 years out and maybe not be happening right now. So.
I'm ready for one more question from the judges in case you have one. And no is a perfectly acceptable answer. Thank you very much. ShareCare 2.1, 2.2, 2.3. And I would like to welcome team number 19, HeartNet, to the stage. And I would like to welcome Compass Community Network to come down here to get ready. Compass Community Network, I want you down here. And after that is C3 Health, but just be mentally ready. All right. HeartNet.
So we're actually Health Gig, and our friends HeartNet will be going after or soon after.
Aha, thank you.
Just to trick you guys.
So we are Health Gig, and we want to reduce readmissions. We want to help healthcare systems by improving patient follow-up with a human key concept. For example, heart failure patients are overwhelmed at discharge and at high risk for readmission or death. We provide the clinical and the emotional support for that side. Our solution is giving tools and training to the right people at the right time, in the right place, for the right cost. We also would have a network of on-demand healthcare professionals and coaches.
20 to 40% of readmissions are preventable, and patients are overwhelmed at discharge. So think about your grandma. She just got diagnosed with heart failure. She's got a bunch of new medications she's got to take. She was sent home with a new device, a HeartNet, a Hummingbird, and a weight, and she's got to remember to use all those different devices. We've got a solution that allows clinical professionals as well as people like us to sign up to either be health coaches or turn on the app and just check in with patients as needed. We've also got a surge functionality to help make patients and providers aware when there's additional need for their services. In our program, we are help triaging patients to the right level of care before they're actually admitted via EMT or 911. So via our system, we're also collecting data that we can either integrate back to the EHR or just improve our own algorithms to identify whose grandma actually needs the most care at the right time. So we've got questionnaires for the providers to help make sure that they're in the right sector, and we've also got clinically specific questionnaires for patients to make sure that they're not readmitted for even higher risk diagnoses like sepsis. We've looked at some of the financials, and this costs hospitals $7 million per year or $20,000 per day. And we've also done some of the analysis for what it would cost us to pay doctors, nurses, and even health coaches to use this program. So please sign up with us. You can check it out online or check out one of our clinical follow-up systems at these links.
All right, Team Health Gig, I want the judges to make sure you look at your paper and write down Health Gig. I'm sorry for that. And questions?
You have a way for screening your workforce?
Yep, so the first step in all of that was actually a background check. And then from that, we'll know what their actual clinical credentials are. And we've also got training ourselves that we would train our health coaches on, as well as the providers on how to use our tool, our app.
All right, thank you very much. That was Health Gig, and I think HeartNet is coming up next. And I would like C3 Health to come down and take a place there by the door. You're a large team, please come into the sunlight. So this here is Compass Community Network. They got renumbered, and so I have a 19 here. There is. And hackathons are sometimes messy, and so I just want to make sure that the judges know the name of the team. Compass Community Network. Go ahead,
Okay.
yes.
Following the previously recalled boil water advisory, Jessica Alvarez unknowingly prepared her son's formula and bathed him in lead-contaminated water. The Alvarez family, like many others with limited English language proficiency, experienced prolonged and unnecessary exposure to lead-contaminated water due to poor crisis communication infrastructure. What was missing from Flint and other communities facing crises was an efficient, coordinated effort to deliver credible health information to all segments of the community, regardless of their language preference.
To tackle this problem, we propose to tap into community leaders and organizations. These trusted partners include hospitals, barbershops, laundromats, and libraries, areas where people typically congregate and share knowledge. The Compass Community Network is an app and a complementary website vetted by an authoritative source to help fill existing information gaps in health communication. This would enable community partnerships to share up-to-date information with residents. A few key features of the app and the website include a map of areas of impact which show resources in the area, and it also delivers information in a user's preferred language, such as breaking news. This is a grassroots social justice effort pushed out to trusted community partners to strengthen and build community capacity and respond to needs in real time. Campus Community Network. We plan to help community partners to disseminate health communication information in times of crisis and after. Our overarching goal is to tear down silos and close the crisis health communication gap one community at a time. Crisis is all around us. Campus Community Network will minimize exposure and outcome severity and reduce stress and distress. With a tool like this, Jessica would have been able to save her family.
Right. One question?
Yes. So content creation can be a very unwieldy and effort-intensive operation. What is this? What is the vetting by the authoritative source that you mentioned, and how do you manage that process and the content creation process over multiple languages?
Sure. So the way that we envision it, we would first try to get local community health departments to operate it and also serve as the main infrastructure for it, and then push it out to their community partners or get picked up by the agencies that they know that they're working with, and then individuals could also go onto the app and add that they would be a resource. But the health department, at least with the Flint water crisis, was the hub for information sharing. And so they would be the ones where the EPA, CDC would provide the information, and then it would be in a common folder where the users, so the different service providers, could access through a dashboard what language of the information that they need. And then they can post on the really interactive map, real time, what kind of information or resources are available at their specific site.
Michigan.
So this is HeartNet, and I expect C3 Health next. Okay, good. Coming back to it. And I want the gatekeepers to get ready after this next. So HeartNet.
Good afternoon, everyone. We are HeartNet, an application to improve patient engagement and chronic disease management utilizing biometrics and interpersonal networks. My name is Harsha Parchani. I'm a sophomore in electrical engineering.
My name is Anthony Wong. I have a background in clinical medicine, and I'm a student at the School of Public Health. So the app that we developed is going to be addressing congestive heart failure, which is one of the most prevalent diseases in America right now. I remember as a family medicine intern, I saw a lot of patients with heart failure come in with incomplete or completely missing weight logs, and that's what we tried to address. Congestive heart failure affects 6 million Americans right now. It's the single most frequent cause of hospitalization in patients over the age of 65, and it accounts for $30.7 billion of spending a year. If we break it down, you can expect each heart failure patient to be admitted to the hospital about twice a year, with each admission costing about $15,000. So if you take a system like Michigan Medicine, which deals with 50,000 admissions every year, even a reduction of 70 admissions is going to save them $1 million.
The goal of HeartNet is to provide a post-discharge network that would provide the patient with information to take better care of their health in a community that would empower them. We plan to do this using 2 data sets, subjective data as well as biometrics, and based on that recommend the proper level of interaction for the patient. Our patient interface is both interactive and flexible. The patient can monitor their biometrics, see any change in physiology, and the social aspect is there to ensure that the patient isn't going through this alone, but has the support of family and friends, in addition to a provider portal to answer any questions or concerns. The provider interface has a list of all of the provider's patients. They will also be able to access the self-reporting data of each of their patients, as well as the vital monitoring of each of their patients. And in case of a concerning trend for one of their patients, HeartNet would notify the provider and show them the course of action that the patient has been taking to provide the best possible care.
And we focus mostly on CHF because we know that companies like Fitbit have scales already, so we can gather that data immediately. Go Blue.
Questions?
So these folks are chronically ill, many of them are elderly. How do you engage them to use the app? It looks, very impressive as you structured. The providers will use it, I would guess, but how do you get the patients to really engage with it?
Yeah, so I think the first step of implementation is just to even give them the scale to say that, you can step on this once a day, you don't even need to write anything down, and that would provide the provider more information. And then I guess it would also require some, reimbursement from the insurance side, which I hope with, quality-based payments, it would help because you have, more, a higher percentage of your CHF patients that, are compliant or have better outcomes.
So the app would be prescribed by the doctor after admission, and after that, they would have potentially a reward or incentive system within the app that could get them motivated, along with the community component that will help keep them motivated. They see like, oh, my friends that also have this condition are taking care of their health. Maybe that'll motivate me more to also be engaged as well.
Yeah, and we were also thinking about like a geofencing system kind of going with Health Gig, where you have a local network of people that either have downloaded the app that all know that they have CHF, and then if you're within like let's just say a nursing home, you have two patients next to each other that might not have talked about their health issues, they can become a community there, or you can reach out to the on-demand individuals that are in the community.
All right, excellent. Thank you very much. And we're getting ready for C3 Health, and I would like the gatekeepers to come down. Very good. The next team that I'll be calling up is Sharing the Blessing. Just get mentally ready after those guys. All right, C3 Health.
All right, welcome to C3 Health. So there's currently a lack of data surrounding the activities of high utilizers to the ED once they have left the ED. And this puts a tremendous stress on the healthcare system to the tune of about $1 billion annually. So even though that patient journey may not be necessarily visible to patients and providers, there are community workers that are on the ground with these patients day to day, interacting with them, and we want to utilize their knowledge and resources to assist these high utilizers in being able to navigate these resources. And so a lot of studies have shown that social interventions can prevent avoidable admissions. And so we would like to engage these high utilizers by creating a collaborative healthcare ecosystem and analyzing behavioral data.
So like Daniel said, we're going to attack this by looking at a huge behavioral data set. But in order to get that data set, the right data in context in the community, we really need to understand how we can engage social workers on the ground to get that right data. And so, for example, we're going to do this by collecting data on cards. For example, patients in the community will receive a card with RFID tracking, can be swiped at various touch points in their ecosystem. For example, this can be swiped at a shelter. This data will go directly to a secure database, and now we have interaction data to work with. And so using this data, we can look at short goals. For example, giving physicians the 360-degree view of the patient's life cycle and what their life looks like between emergency department visits.
Our initial idea is to roll this out in Detroit, where our business plan has identified a $4.7 million total savings opportunity. We believe that C3 Health can be expanded, and that this will create a nationally available healthcare ecosystem, which will spur policy change and additional dollars invested in social work, which will fundamentally change the way we look at healthcare delivery. Thank you.
C3 Health. Question?
So to underscore again the business model. So how will you jumpstart this and disseminate it?
Sure, that's a great question. So our business model is primarily, focused around the fact that ED readmissions cost hospitals a lot of money. Again, like a primary goal is to focus on the population here, which is homeless individuals or disadvantaged individuals. But looking at the ED rate, if we can prove that we can drop that down, hospital systems will want to invest in it. In a subscription model, we could easily start working with health systems, roll them out in a Detroit pilot study, show that we can reduce ED reutilization rates. If we can show that, we can demonstrate that this can be rolled out nationally, and hopefully, since EDs are very high utilized services, show that this could overall decrease the total healthcare spending in the United States.
All right, thank you. The gatekeepers are coming up, and I would like Sharing the Blessing to line up next. After that, Health Gig Just get ready. So the gatekeepers.
So this is Steve. Steve recently started a new medication and has been having trouble keeping food down. So he calls his primary care provider to schedule an appointment. And after he describes his condition to Diane, the front desk clerk, she decides that it's a non-urgent condition because he also mentions that he'd been drinking the night before. And so she schedules an appointment for him a week out.
What if Steve was experiencing symptoms of a more serious health issue? How many times does someone like Diane brush off a seemingly minor ailment, attributing it to stress or something else due to a limited amount of formal health education? What if Steve needed help now and the front desk staff could assess that better? Diane is Steve's first and often last point of contact when accessing care. How can she be better empowered and integrated into Steve's care team? What if Diane had a decision aid tool that helps non-specialists assess health risk and urgency to make better scheduling and staff-to-physician escalation decisions?
We propose a clinical decision support tool made specifically for the front desk staff. When Steve calls, Diane sees the screen and types words Steve is using to describe his condition. In real time, a text analysis algorithm screens for keywords in Steve's description, providing Diane with important follow-up questions to elicit more nuanced information. This helps determine risk and ensure Diane makes the appropriate scheduling and escalates decisions. For instance, Diane can transfer Steve to a nurse on call or recommend emergency care. Or if Steve needs to see a doctor, the system will prompt Diane to schedule him within 3 to 7 days. Or she can continue as usual to find an open appointment time.
This resource has the potential to optimize in-office time and avoid unneeded care, which matches the transition away from fee-for-service towards value-based care. It also makes sure patients like Steve access the care that is most accurate to their needs. So our primary audience for dissemination would be providers of EHR systems like Epic and Athena, along with those who develop health record add-ons like Great Lakes Health Connect. This would make their product even more marketable and helpful to their customers, enabling implementation of value-based care and clinical workflow optimization.
Empowering get. Oh, I just.
No.
Close enough.
That's it.
Yeah.
I was just about to say just in time.
Yeah. That's okay.
Question from the judges. And no is an acceptable answer. That just means you were very clear. That's excellent. Thank you very much. Those were the gatekeepers. I would like to invite sharing the blessing up. Very good. And I would like HealthGig to come down here, please. You went already. Oh, that's right. You went already. That was the confusing part. In that case, I would like HC Trivia to come down here. And after that, we should be in flow again, which is perfect. All right. So, sharing the blessing.
Good afternoon, ladies and gentlemen. My name is Ariel, and today I will present the personal healthcare app for Syrian refugee in Zaatari camp. Zaatari camp. As of 31 December 2017, the United Nations High Commissioners of Refugee recorded 655,624 registered Syrian refugees in Jordan. Personal healthcare app for Syrian refugee in Zaatari camp. It's an electronic app that addicted to raising health awareness regarding personal care among Syrian refugees in Zaatari camp. It's free and easy to download. Why this app is important? Increasing number of refugees in Syria board who stayed for days caused the transmission of diseases easily, especially among women and children. How to separate this app in market? Through an ad featuring celebrities calling on the community to volunteer to enrich the health continent, personal health care for Syrian refugee. Please give him applause, please. And second, how to separate this app in market, granting like certificate to volunteer who dedicated themselves to raise the awareness about personal health care for Syrian refugee inside Zaatari camp. Remember, share your blessing with others. Thank you.
Questions from the judges?
My question is, I'm actually not familiar with the level of access that the Syrian refugees or in that situation that they would have to technology to use this app or access other information. So the app you describe, is that something that would be readily accessible by most Syrian refugees?
Well, as I said, this kind of project will be like through the volunteers, like educated, professors, students who can like create like an app for that, and we can like doing like a partnership with Microsoft to over like this kind of apps to the Syrian inside the camp. We don't want it to them to be like outside this world. What happened is enough for them.
All right, thank
Thanks.
you. So HC Trivia is coming up, and I would like Virtual Visit to line up next. HC Trivia. Just come into the light. I'm really not scary.
All right. Hello, everyone. We created an educational app called Health Communication Trivia, aka HC Trivia. Oh, there we go.
So the problem is that individuals with limited literacy have higher rates of illnesses and hospitalizations than those with better reading abilities. So we decided to address this communication gap in health literacy.
HC Trivia addresses health literacy by targeting minors through a trivia game app with monetary incentives.
So how are we going to do this? We're going to build a trivia game, focus on current medical issues, and engage our users at the same time.
And we are going to base our app off of HQ Trivia, which currently has more than 2 million users daily.
So as you can see, the question database would have a vast number of topics that could be implemented. Some examples are listed up here. You can read those. And the benefits of this app would focus on lifestyle modifications, which could potentially decrease future doctor visits and reduce healthcare costs associated with that. So we created a prototype.
Yes, here's a video of the prototype, and then so as users answer questions correctly, they advance closer to winning the game. And additional information is shown between questions.
So after each question, you have an educational component. It tells you what the correct answer is, why the other ones are wrong, things you can do to incorporate this content into your life and remove bad lifestyle decisions from the ones that you might have adopted already. And so we have a few more questions like these. We'll just skip through them.
Yeah, and then if they answer wrong, YouTube videos are provided for more information. And then after the competition, a leaderboard shows a list of the winners.
Judges, questions?
Did you have a business model for this?
Yes. So first we do a pilot study, a pre-test, and a post-test to see if it's actually effective in educating students. We focus on grants for initial prize money and go from there. Perhaps implement ads for extra lives. So students who are really invested in this, who want to win money, they can have another shot at it. Yeah.
So do you have a hyperactive host lined up, like H2 Trivia?
We're looking for him. Yeah, we're looking for Scott 2.0. I'll take it.
All right, thank you. Team Virtual Visit, and I would like Team Best Gut to come up next and line up. And if you've been walking around, you've probably seen these guys with their hardware.
Hi everyone, I'm Sammy, this is Haran, and this is Victor, and we're the team behind Virtual Visit. So imagine you've just been diagnosed with a medical condition that requires treatment. What does that look like for you, and what will your treatment facility be like? Or imagine you're the parent of a child who's just been diagnosed with cancer. How do you explain to your child what their treatment is going to be like so that you reduce their anxiety on that first day of treatment? Or
You know you need medical treatment, and you're trying to find the best facility for your care. How do you compare that without touring each of those facilities, which requires time and maybe missing work or school? We created virtual reality tours of healthcare facilities so you can learn more about your treatment and the facility you'll be at without having to leave the comfort of your living room. So our VR tours feature an animated guide that takes you through the treatment and helps you understand all the steps and everything you need to know about the treatment before you even step foot inside your hospital. We have a quick demo that we've prepared for you. So we created a version of the radiation therapy treatment facility from Michigan Medicine, and we've tailored this one towards younger pediatric patients. Apologies.
I'm Meg. Job to help you get familiar with radiation treatment. The big machine behind me delivers the radiation, the exact parts of your body that need it. It can turn in either direction to reach any unhealthy cells. It can make a lot of noise, but don't forget to keep still. The bed here will have pads on it to keep you still and comfortable. It spins around too, to help keep you extra still. You might get a special mask. These masks are molded just for you. They help keep your head and neck still while you're getting treatment. You have to be alone in the room, but you can listen to your favorite music or book while you're here. Your care team is here to help make sure you stay comfortable and healthy. Goodbye.
Questions?
So your model for this to support it.
So we actually used the Amazon Sumerian technology, which is Amazon's platform for virtual reality development, to create this video. So it will be available online. So all you need to access it is a smartphone and internet, or you can view it like you did there through any computer. So it's accessible and low cost.
Adding on to that, so like why we use Amazon Sumerian is because the host you saw is actually like an Amazon AI, so it will act like Amazon's Alexa. So like you can ask him ask the host like specific questions, and it will answer based on the clinic's information. So you can ask about like insurance policies, appointment times, and stuff like that.
All right, thank you very much.
Thank you.
I would like Team Best Gut to come up stage, and I would like Team Life Tether to come up and line up.
Hi, all. We're Best Gut. We're here to show you the possibilities of stool. With current health devices, monitoring your health is too generalized. Often, they require constant data entry, which is both annoying and subject to user error. How do we get better data from your stool? Health can be better linked to your microbiome composition. Our microbiome are bacteria that enable us to digest foods, fight infections, and serve as proxies to a host of diseases, from obesity to cardiovascular disease. In short, they help keep us healthy. Monitoring the gut microbiome can be used as an early detection metric and can be also used to monitor the effectiveness of various disease treatments, such as for inflammatory bowel disease. Bad microbiomes can equal a poor quality of life. We'd like to present the Catamaran, a toilet drop-in device that can work on any toilet and measure the stool sample in real time to get you your microbiome composition. The Catamaran scales the sample upon contact and then wirelessly sends the data to the app. The unit is cleaned by the normal flush of the toilet. The data is displayed in a dashboard on each user's phone. It's an easy way to understand the map of your microbiome. The user's data log can also be shared with their health provider to learn more detail about their microbiomes. Our current competition offers smart toilets costing anywhere from $600 to $25,000. The major problem is they only offer basic data and do not provide any information about your microbiome. We'd like to bring this technology to market by appealing to the current health-conscious population. Our market is those who are already using existing health tracking wearables. By Forbes' estimate, this is 1 in 3 Americans. Preventative healthcare microbiomes is the future and the now. We hope to empower users through fact-based health tracking and metrics to communicate more efficiently. Learn more about yourself than you thought possible.
All right, questions?
Do you think we know enough about the microbiome for it to be actionable right now if I buy one of your smart toilets?
Actually, the NIH is actively studying it currently. So this is definitely a concept phase, but there's so much potential into it. And any of you might know the Human Genome Project. This is the analogy to that for the gut and all the bacteria that live inside of you. So there's a lot you can learn from human waste, which we actually call human gold. Yeah, it has a significant amount of information you can collect from it. And this is one of the ways we hope to gain insight into your health and help you proactively track that.
All right, thank you. Life Tether, come on up. And I would like Strawberry Giraffes to come down and line up here. After the Strawberry Giraffes, who are lined up, we'll have Blockchain MD, which is the last but not least team. And this is the first time we have a tech kerfuffle. I think that's actually pretty good if we're thinking about 30 teams. So I think I'm okay with you. Now I'm just saying that for the next team, that doesn't go, right? We can't have 2 kerfuffles.
I don't know what's going on, sorry. Okay, let's try this. Okay, apologies.
We're exhibiting Murphy's Law. We'll give it another shot. I saw it briefly.
It's showing up. Oh, no.
All right.
Finally, sorry. Oh, sorry. We are Life Tether. Opioid deaths are an epidemic in the U.S. In Michigan, it is eclipsing car accidents and gun violence and deaths per year. While opioid overdoses are reversible, it requires someone to be there. If you're alone, no one can get to you in time. When an opioid overdose happens, your heart rate slows down, your oxygen saturation levels go down to the point of death. You can intervene, but it has to be fast. Currently, there are many devices and wearables today that measure one or both parameters. So if something were to go wrong, it can sound an audible alarm and buzz to alert the user. It can also send GPS coordinates and alert text to named contacts in the app. In the future, we can connect to EMS systems.
So we have our initial prototype app in which we can add emergency contacts, and there's a standing alarm button which dispatches text messages to all the emergency contacts. And on the right, you can see we have a Fitbit simulator which dispatches an alert if a heart rate falls below a certain threshold. And in future development process, we plan to replace the standing alarm button with the Fitbit, basically.
The 42,000 opioid deaths in 2016, many of them are preventable. We want to connect the available tech that's on the market with a family and friends network to save lives. We think we can do a freemium model where the first 3 contacts and real-time alerts are free, and we can pay more for more functionality. We want to partner with rehab centers, crisis centers, and methadone clinics to promote and market this life-saving application. Thank you.
After a tech kerfuffle, perfectly in time. Questions from the judges?
Are there any thoughts about sort of medical legal ramifications?
This would be purely opt-in, so we would be targeting people who have relapsed and have a history of known overdoses, and they would
Any-
opt in with their contacts.
Any concern in terms of the context? Would there be any?
It would have to be accepted by both sides, so there would be permissions on both sides.
All right, excellent. Thank you. I'd like the strawberry giraffes to come up, and I would like Blockchain MD to line up. Willing the screen to life.
There we go.
And it worked. Beautiful.
Righty. Hello, everyone. We are Team Strawberry Giraffes, and today we're introducing Breathe Easy. So the problem we're focusing on is overutilization of the emergency department by asthmatic patients in the city of Detroit due to, 1, limited health literacy, and 2, the lack of a long-term care plan. So why do we care about this? We care because the asthma prevalence in Detroit is a huge problem. We also care because these patients are seeking their asthma care treatment at emergency department visits, costing, on average, $1,500 per visit, and at a hospitalization rate 3.5 times more than anywhere else in the state. Which leads us to our real health communication problem. With low health literacy rates, coupled with the lack of a long-term care plan, something as simple as which is the right inhaler to use can become a problem. Introducing Alia. Alia is a 17-year-old high school asthma patient who wants to make the varsity swim team this year. She lives in Detroit, and she's been at the ED this year 5 times for her asthma. Alia is frustrated because she doesn't have a long-term plan to manage her care away from the ED, and she doesn't understand the identifying triggers that are actually triggering her asthma attacks.
So we propose a 3-part solution that we've called Breathe Easy. The first component is a wearable wristlet that monitors the patient's environment, so levels of chlorine and NOx gases that the patient is exposed to. So when Aaliyah goes to the pool, it's going to pick up that there are elevated levels of chlorine in her environment. The second component is an attachment to the inhaler. That way, when she goes and takes the puff from the inhaler, it signals the system that there was an asthma attack. And then afterwards, she gets a notification on a device that says, hey, you had an asthma attack when you were exposed to elevated levels of chlorine. Here's some more information. Now she can take ownership of her situation and knows the next time she's going to be exposed, she can preemptively take her inhaler. And this costs $100.
So how does Breathe Easy add value? Breathe Easy adds value by reducing the number of emergency department visits.
Thank you.
Thank you. Do we have questions for the Breathe Easy Strawberry Giraffes or Strawberry Giraffes Breathe Easy?
Yeah, just expound just a little bit more about how the provider or the system will be engaged with the plan.
So we're trying to take a coordinated approach where at the level of the pharmacy, first and foremost, the patient can identify, and this is what Ali was mentioning, there's a sensor cap that is placed on the rescue inhaler, and this is part of the patient education piece where now the patient can identify which is the rescue inhaler. We're also focusing on the fact that it's going to reduce ED visits tremendously, and that's what Aliyah was about to get into. And so at the cost of $100 versus $1,500, we're actually reducing this, and we're giving patients a long-term, kind of a empowered long-term care plan. And then at their infrequent, so Aliyah as well, this is also part of her persona. She had infrequent visits to her primary care physician. And so now she actually has the empowerment to kind of take ownership of this long-term care plan. And during her infrequent visits to her PCP, she can actually adjust that accordingly.
All right. Any questions? Thank you. And the very last team of the day, we've got Blockchain MD.
All right, so Blockchain MD is a blockchain solution for sharing medical records between health professionals. So a blockchain is made up of individual blocks with 3 components: data, hash, and the hash of a previous block. So a hash is just a summary of the data. So that means that the same data will always produce the same hash, but you can't recreate data from its hash. So cryptocurrency is a hot topic right now, and for Bitcoin, for example, it uses this blockchain technology, and each block would contain a sender, a recipient, and an amount of Bitcoin, for example, that you'd want to transact. And in our case, we would just be using, instead of the amount of Bitcoin you want to exchange, encrypted medical data.
So blockchain is useful for this application because EMRs currently are centralized to hospitals, so they are running on the security and the standardization of those hospitals. Blockchain would solve this by decentralizing. It's immutable, so no data can be lost or damaged. It's public data that can be used for analytics and stuff in the future. The public data is the to, the from, the hash, and the previous hash, and the private data is that only the recipient has access to, is the medical record data. So this is our like pretty fleshed out demo. So there, you can sign up with a new user account with a very secure password and upload a file, send it to Sanjay. The file select thing didn't come up, but I'm looking for a file right now, and then upload it, and it adds it to from Grady Memorial to Sanjay, and it shows the hash, and it shows the previous hash. And then I sent something to Grady Memorial earlier, so in the downloads, you can come and download it, and the download window didn't show up either.
Questions for this team? And you get to say no. Excellent. Team Blockchain MD, thank you very much. Boy, I'm going to say I am quite glad that I am not in your shoes, dear judges, because this is going to be hard. 30 teams, they delivered excellent pitches. You will have a tough time. We thank you very much for your time. I think Elise is going to take the judges out of here for deliberations. There is a quick survey as to what the best pitch was for all of us here in the room, independent of the judges. And that is on the next slide on this. Hold on. I can do this. How do I flip slides? I don't see a keyboard. Here. It's on here. Excellent. So everyone in the room, you don't have to sit here. Now you know how to do it. We take 10 minutes. And the judges are out for a little bit longer. We take 10 minutes to take bio breaks. Which one of those 30 was the best pitch? And, get a snack, get a glass of water. No water, no food in here. Come back in about 10 minutes for Q&A with the Guptas. Thank you. At 3:10 exactly. That is, we will start, and practically, I can't make you all be in here, but we would love for you to be back in 10 minutes. Thank you very much. Applause to all the teams. Thank you to our judges. We'll see you shortly.